My name is Gina Cole. I work with Pajaro Valley Prevention and Student Assistance. We're a little nonprofit here in Watsonville. We wear several hats. One of them is we are mental health providers for the Pajaro Valley Unified School District. So we have master's level interns and licensed clinicians in almost all of the schools in the Pajaro Valley Unified School District. We have drug and alcohol counseling. We have a number of different restorative justice programs. We work with police departments. We work with PAL. We work with a lot of the different community partners to create a better life for people here in the Pajaro Valley Unified, Pajaro Valley in general. The other piece, and my piece of it, is that we have a long-standing history of tobacco control work. So I currently work on a couple of different grants. One of them is through the California Department of Public Health, which works with creating smoke-free policies for different agencies, specifically around behavioral health facilities. I've worked extensively with Janice, and I'm looking forward to coming back. And we've worked with Jody Wells, with you guys over at Mariposa Wellness, to develop smoke-free policies at the work site at those facilities, and also with MHCAN. We also work with multi-unit housing facilities, so sometimes it is apartment complexes, and where we're looking at working this year is more with transitional housing. And then the third objective that we have is going to be tobacco-free pharmacies for the county. So that's kind of a role. San Benito County just recently went. So they have smoke-free, an ordinance that creates tobacco-free pharmacies. The other piece of it is education. We work in the schools. So we bring tobacco education to the schools, the 6th through 12th graders in the PVUSD school district. Today, though, I'm going to put my mental health hat on. There have been so many reoccurring themes that people have talked about and built on and built on and built on through this whole presentation. I loved Dr. Jaffe's how to make your trips not a faceplant. And I think that's what all of us are here to do. That was brilliant. That all of us are here to do that is to assist our clients and the people that we work with on a day-to-day basis, and even the people that we love and hang out with, in having that kind of be their goal, that it's okay to have a trip, but hopefully we don't lose it completely. I loved about setting small goals. I loved Andrea saying that changes made during the day programs didn't always carry over. And so that's a lot of the work that we do. Like, we provide these awesome supports for people during the day, but what happens when they go home? And Jose, louder. Oh, what was this? Am I too fast? Oh, okay, sorry. Okay. Was saying that he was able to utilize those tools that he learned into his real life, and that's like a big goal for all of us, right? Even me, procrastinator lady extraordinaire, or overeater occasionally, those kind of things, where we're using those tools that you're receiving here today. Anyway, what else was really awesome? How much our emotions are tied to the things that we use. Hannah talked about that we're emotionally tied to our food. We're emotionally tied to tobacco. We're emotionally tied to drugs and alcohol. We're emotionally tied to those things that sometimes hurt us. And again, using the tools that we can to make that better. All right, would you flip the next slide so I will shut up here? Sorry. Okay, so just a couple of tobacco facts. Smoking is the #1 preventable cause of premature death in the United States. Done. That's it. It is. If we could get people to stop smoking, they would live a lot longer. Tied into that is there's approximately 600 ingredients in cigarettes, but when they burn, that chemical reaction creates up to 7,000 different chemicals. We know that almost 70 of them are carcinogenic, and we know that many more are poisonous to our bodies. Any level of secondhand smoke is dangerous, and that's from the CDC. They have a bajillion reports. They're a great source of information, the Centers for Disease Control. Some of the smoking and or exposure to secondhand smoke, it also increases the risk of pregnancy complications. And Jessica spoke to this as she hung out for a lot of years with a lot of women in her program, and you would see low birth weight babies, you would see early babies at times. And so reducing secondhand smoke around women and reducing their tobacco use is really important as well. Coronary heart disease kills about 150,000 people a year. Stroke, emphysema, COPD are all health effects of using tobacco and tobacco products. People with diabetes are at a 30 to 40% higher chance if you're a smoker. Asthma, another thing, can be triggered by secondhand smoke. Our oral health can be affected by tobacco products. According to the CDC, about 30% of all cancer deaths are attributed to cigarette smoke or cigarette smoking. Of those bajillion chemicals, things that you would normally every day use in your house: acetone, which is nail polish remover, ammonia, butane, carbon monoxide that comes out of the back of your car, those are all things that are present when someone is smoking using cigarettes. Ammonia has a really unique job. Its job in a cigarette is to make the nicotine absorb faster. So interesting little fact there. Just gonna touch a teeny tiny bit, it's not up there, but talk about e-cigarettes for a second. The studies are happening now about e-cigarettes, about their use. We know that youth use is way up. That was one thing that's very concerning. It doubles every year. Let's see, where'd that go? Sorry, I had numbers. Not that we really care, but we do care. 1 in 7 high school students has used an e-cigarette in the last 30 days. 1 in 7. I'm not here to tell you what to do. I'm not your mom. I'm not here to tell you what to do. I'm not here to tell you what not to do. But I am here to tell you that it's not water vapor. It's an aerosol, that there are chemicals in there that, when ignited, become very similar to the chemicals in regular tobacco products. I'm not here to tell you don't use them, even though I'd like to tell you don't use them. I have seen people successfully quit. I've seen people successfully use both. So again, just know that there's no safe level of tobacco smoke and there's no safe level of e-cigarette vapor, which we call aerosols. Go ahead to the next slide if you would, if you could. Related to behavioral health. You've heard it from every single person up here. People with behavioral health disorders die approximately 25 years earlier than everybody else in the general population. And about half of all people with behavioral health, with mental health issues, disorders, smoke. Again, that's compared to about 23% of the general population. So it's double. People with behavioral health disorders and addictions smoke about half of all the cigarettes that are made. That's a lot. But they are only half as likely to quit. We'll talk about quitting in a minute. Smoking-related diseases cause half of all the deaths among people with behavioral health disorders. And we know what those are, we listed those. And then this I thought was really interesting, and this is something that we can work on, is that 30 to 35% of those that work in the behavioral health setting also smoke. So health workers that are smoking have a higher incidence in this population. And that's compared to 1.7 of primary care physicians. And that goes in with a lot of other things that the CDC looks at. One of it is income. The other thing is education. So the higher your education, the lower your incidence of smoking. The lower your income, the higher your incidence of smoking. Only about half of the substance abuse recovery programs screen for tobacco. And a lot of them don't offer cessation support. So that's something that we want to look at. And the same goes for housing, especially for people in a recovery setting. They go from a program that's very structured, they have a lot of support, they may even have a cessation program in place, and they move from that to a sober living environment, to transitional housing, where there isn't as much support, where there isn't as much of a structure, and a lot of people begin either smoking again or using again. So we're looking at that as well.